tokinige county nebo Narok kole kigusini ko ang logoiwek chetinyege ak tililindo ole kagomwa principal secretary en ministry nebo tililindo en emoni Mary Muthoni kole kebeberta nebo 20% en biik chemiondos chebendi sipitalisiek kochenge konyoiset en emoni kotindoi miondo nebo malaria nenyoru kobun umbu ole kinyoi biik chesire million 20 en emoni kobun miondo nebo malaria. Kongololi Mary Muthoni en sipitalit nebo referral nebo Narok en tuyet nekoindochi nebo kokoitoet nebo netisiek kesire 1700 koityi korik kesire 1200 en county nebo Narok. Komwa kole kebeberta nebo 20% ko biik chebendi sipitalisiek cheterter en emoni konyoru konyoiset nebo malaria nebunu umbu ole en county nebo Narok ko biik kesire 1300 chekinyoi en miondo nebo malaria. Kosibke ak PS Muthoni kokosuldaen serikali kakwautik chekiteren miondo nebo mpox ole biik oeng kityo chekikinyorchi mionoton nebo mpox en emet en biik kesire 68 chekikiyochi chikilisiet.
I know you have heard of mpox. Hii ugonjwa inatuandama. Nasema inatuandama kwa sababu haijaingia kwa nchi kabisa. Tumefunga mipaka, tumeweka screening pale kwa point of entry. We have been able to enhance our surveillance. Na out of the 68 samples that we had, only 2 have been confirmed for the many weeks that we have done the check. With malaria alone, responsible for approximately 20% of hospital admission. Wale watu wote wanapelekwa mahospitali, the admission is for malaria is 20%. So the burden of this disease is particularly high in rural areas where access to health care is limited, exacerbating the impact of vulnerable population. Malaria is preventable, as I've said, and it is treatable, but it continues to devastate impact on people's health and livelihoods around the world. In 2022, the world reported 249 million malaria cases, an increase of 5% from the previous year. We recorded 5,477,220 malaria cases, underscoring the persistent threat posed by disease. Even closer home, Narok County, we have reported 357,110 cases, reflecting a rate of about 1%, slightly lower than the national average. The national malaria prevalence is around 6%. We have been able to distribute 12 million long-lasting insecticidal nets across 18 counties, reaching 3.9 million households and protecting about 24 million people in Kenya.
En komastanyin kakamwa rubeiwotab governor en county nebo Narok Tamalinye Koech kole nyolu en meng'ik chebo county noton koboisien netisiek choton en oret neititayat ak koyomis kole tesetai serikalitab county nebo Narok ak tetutik chekiteren letaetabgei nebo miondo nebo malaria.
Malaria is among the top 3 causes of mortality in our county. During the last financial year alone, 16,622 cases of malaria were reported and attended to in our health facilities across the county. This shows that the extent of malaria burden on our facilities and therefore informs the need to put in place effective malaria prevention mechanisms which will avert malaria infections and reduce the malaria burden in our county in the long run. So we are very sure that all the distribution centers will be able to do their job as from today, tomorrow up to date 1. 640 of them. Madam PS, thank you. We really appreciate your efforts, your impetus towards assisting our county, towards working with us so that at least we assist our people. We have 100 dispensaries. In the last government, they had 93. So we have added, I think, 7. We now have 100. We have 27 health centers, and we have 3 level 4 hospitals and 1 county referral hospitals. All of them are operational, and that we have 1,426 health staffs in this county. And in the next few months, we will add another 400 medical or other health staffs so that they assist us in terms of service delivery in our hospitals.